Hello, Dr. Khaldun. Welcome to MEA TV and Radio. My first questions to you is, what do you mean by stay home, stay healthy?
So the most important thing we can do to fight COVID-19 is social distancing. And that means that people should not be leaving their homes unless they absolutely have to. And that means getting food, getting important medicine, or doing an important job that is critical for the health and safety of the people of Michigan. So that means if you're not doing that, you should be staying home and staying safe.
Okay. Just that if there is necessity to go to the store or a place that's important to the family, what you're telling the community member by staying social distant, and what is that will do for a person if it doesn't do that?
Right. So social distancing means staying at least 6 feet away from other people. And we say that specifically because we know that this disease spreads through the air. So respiratory droplets, when someone coughs or sneezes, and even just breathing, it can spread through the air in that way. So that is why we're recommending people do social distancing. It's also important to know, even if you do social distancing, if you touch something like a doorknob or a light switch or a cell phone, if someone has those droplets on that phone, you could still get it that way. So it's really, really important that people clean these frequently touched surfaces often and also maintain that social distance of 6 feet as much as possible.
Okay, if somebody say, I'm very healthy and I don't have the system, should I stay home?
Absolutely. What we know about COVID-19 so far, it is not just impacting people who are elderly or people who have chronic medical conditions. Those people are at higher risk, but we've also seen 20-year-olds who get very sick or, quite frankly, who die. So this is very, very serious. You may be young and you may be healthy, but COVID-19 is looking like it can still be very, very serious for you as well.
And if somebody want to visit a friend and not too far from them, they want social, but they want to keep with them, with those friend or this family, can they go and visit that family or that friend?
No, people should not be going to do home visits at this time. You can be with the people who live in your home, your household members, but you should not be having those close family gatherings or going to visit friends unless they need help with getting their food or they need help with making food in their homes or bathing. If you are that one person who can help that individual with that, then you can do that. Other than that, this is not the time to have play dates or family gatherings at all. People really need to be staying home, only being in touch with the people who live with them.
I see. And if somebody he's got the coronavirus, what he should do? Should he call the doctor? Should he go to the emergency?
So if someone thinks they have symptoms of COVID-19, they should call. So not show up, but they can call their doctor to talk about their symptoms and get recommendations for what should happen. Unfortunately, we do not have enough tests in this country to be able to test every person who has the disease. There are some people, those who are older, those who have chronic medical conditions, those who are frontline, like healthcare workers, who are able to get a test, but many people will not be able to get a test. People should not go to an emergency department unless they absolutely need to.
But if somebody exposed to the virus, should he call the doctor? What he should do? And he doesn't have the virus, but he suspects because he have probably sneezing or one of the symptoms that this virus show.
So again, if people have symptoms, they should certainly call their doctor. If you're sick, you should certainly stay home. We're also now recommending that people wear a homemade face mask if they must go out. But they should certainly call their doctor to get a recommendation for what they should do. For a lot of these, when someone does have COVID-19 and their local health department knows about that, they generally talk to household contacts and people that person would have been in close contact with to make sure those individuals are also looking out for symptoms. But certainly people should call their doctor if they think they have a concern about them having COVID-19 themselves or having been exposed.
And if somebody have that, okay, and what he should do, if he go to the doctor and tell him that he don't need to be tested, just to stay home, and he have that system, what he should do?
So the most important thing is to really, we call it supportive care in medicine. So there's no medication to treat COVID-19. So the person will go home, they'll take Tylenol as they need to deal with the symptoms like fever and body aches. They should drink plenty of fluids as they should if they're sick with the flu. And then it's making sure that they don't get much worse. We certainly are seeing people who are getting sicker and do need to go to an emergency department. But unless you are having real difficulty breathing or just feel like you can't even stand up or very, very, very ill, you should not be going to an emergency department.
If somebody feel, he's in good condition and he is going with the stay home, stay safe, what should he do or what he should do before he get the virus, to prevent getting the virus? Should he take any medicine, any certain food, any certain liquid?
It's always a good idea for people to eat healthy foods, so eat fruits and vegetables, obviously drinking plenty of water, obviously washing hands thoroughly, frequently throughout the day for 20 seconds with soap and water. Again, there's no vaccine for COVID-19. There's no medication for it to treat it or to prevent it at this point.
Yeah.
Right. There is nothing there, but certainly being healthy in general and eating good foods is always a good thing to do for your health.
Okay, Dr. Khaldun, do we have enough tests for the state of Michigan? Are we covering all the counties?
So we, as a country, were behind when it came to testing.
Yes.
We have certainly expanded testing, even in the past few weeks, where we've gone from 9,000 tests to over 40,000 tests now. And we continue to work to expand testing across the entire state. But you're right. Right now, we do not have enough tests, and that means we will not be able to understand exactly who has the disease and exactly who does not. And that's why it's so important that we do this social distancing, because you don't know who may be carrying the disease and spreading it to others if you go out.
Is our hospital today ready to take more patients with the coronavirus, or they over limit? And how's the situation? Please tell me.
So many hospitals in southeast Michigan specifically are already at capacity. Their emergency departments are full. Best case scenario, they have a few days worth of PPE, so masks and gowns and gloves.
Yes.
So our hospitals are certainly getting overwhelmed with the number of patients that they are seeing, and many of them are very sick patients who have to go into the intensive care unit. So it's something we're certainly very concerned about. Because of that, we are actually building additional facilities where patients can be seen. One of those is the TCF Center in Detroit, which we hope to open at the end of this week.
I see. Do you have enough equipment or testing things in the state of Michigan? And did you get enough from the federal agencies?
So we have certainly been working hard, and Governor Whitmer has been really out front on this, asking the federal government for help. We are getting more help. We're getting more shipments of ventilators. We're getting more shipments of masks, and that's been a very good thing.
Great.
But again, as many people as we're seeing who have the disease and our hospitals getting overwhelmed, we continue to need those shipments and that additional support from the federal government. And I've been pleased that they've been supporting us over the past couple of weeks.
Okay. What we understand is this week and probably next week is going to be the peak. Tell me what's going to happen this week and next week, and what's after those peak.
So right now we're still on the upslope when it comes to number of cases. We will continue to see more cases and unfortunately more deaths. Right now, our best estimates are that the peak will be somewhere more like the end of April or the first week of May. Again, we don't know the exact date. It's important to note that even though we're talking about a peak, on the way up to the peak and even on the way down from the peak, that still means there will be many, many more cases and there will be more deaths. So, again, the most important thing we can do to make the height of that peak as low as possible is to do this social distancing so that we can keep people from getting sick as much as possible and stop our hospitals from being overwhelmed by patients.
Okay, what's your final message to the Middle Eastern American community?
It is so important that we be patient, that we stick to these social distancing measures, that we stay home, that we stay safe, that we wash our hands with soap and water, and really take care of each other. That's the most important thing we can do right now.
Dr. Khaldun, on behalf of the whole Middle Eastern community, I appreciate you, and a big thanks to our medical community, the doctors, the nurses, the PA, the EMS, and the law enforcement. And thank you for being in the front line and protect us from this enemy. And we know that we're gonna be prevail. And always our state and our nation prove that. But honestly, big thanks you to everybody.
Thank you so much. You stay well.
Thank you.
Thank you.
Thank you.